Hi everyone, my name is Kendra. I am a new provider at Psychiatric Wellness, and as we approach the midpoint of this hot summer, I wanted to give a short overview of summer onset seasonal affective disorder. While most people are familiar with the winter version of seasonal affective disorder, it is important to know that there is a less common version of this that happens when our days are brightest during the summer. So this is sometimes referred to as reverse SAD, and it manifests itself differently than its winter counterparts. So during the winter, you might see oversleeping, increased appetite, and social withdrawal. Well, during the summer, the symptoms can be quite the opposite, and some people experience insomnia, decreased appetites, a heightened sense of anxiety or agitation, and in more severe instances, it can even stir up violent impulses or an intensified or increased libido. So it's just important to keep these symptoms in mind and seek the appropriate care or help when needed. The summer sun, while usually a source of joy for many, it can actually disrupt delicate biological rhythms. It can alter melatonin levels, which are important for our circadian rhythm and our sleep cycles. And it can also alter serotonin levels, which are important for our mood regulation. Combine this with the oppressive weight of the heat and humidity, also with societal expectations of summer cheer, it can just amplify feelings of isolation and create this paradoxical summer gloom. It's also important to note that for individuals who navigate the complexities of bipolar disorder, the summer can also be a particularly complicated season. The extended daylight can act as a possible trigger and unleash manic or hypomanic symptoms and episodes that would be marked by an accelerated mind, boundless energy, impulsive actions, all while the need for sleep diminishes. So to navigate these summer onset mood disorders, it just requires a multifaceted approach, starting with perhaps psychotherapy. Cognitive behavioral therapy can provide invaluable tools for managing symptoms, providing ways for coping. Also medications, using the SSRIs for seasonal affective disorder, as well as mood stabilizers for those with bipolar disorder, can offer crucial support. Looking beyond clinical interventions, some simple lifestyle adjustments can provide significant relief. So trying to stay indoors in cool, air-conditioned environments, strategically managing light exposure and perhaps staying out of the sunlight during peak sunlight hours. Also, maybe using blackout curtains for creating darkening rooms during sleep hours can be very helpful. And also adding stress-reducing practices such as mindfulness or meditation. And then finally, just embracing the comforts of your community, whether through friends or family or groups, can just really be a beacon in the summer's unease. So understanding and acknowledging the existence of summer onset seasonal affective disorder and the seasonal risk for bipolar disorder is the first step towards providing this effective support and treatment for those who experiencing these challenging conditions. So if you or someone you know is struggling with symptoms of seasonal depression or mood episodes, regardless of the time of year, seeking professional help is a critical step towards finding the relief and improving your quality of life. So feel free to reach out if you have any questions, and thank you so much.